possible. One, to stop further transmission of infection to the healthcare workers, but also the people who come to seek services here. So the hospital is safe. The staff who are working here are properly trained, and will continue to give them support in terms of capacity building, in terms of proper gear, in terms of infection prevention control measures, to ensure that as they work, they are not only safe when they are offering the services, but they also offer safe services to members of the public. So going forward, there's a remaining batch of about 100 staff members to be tested. Out of the 290 who are tested, 41 turned positive. All these 41 have been on home-based isolation. 2 actually have been discharged from home-based isolation care, and the remaining 39 are doing well. Nobody has gone to hospital for care, and we are hopeful that they'll be able to pull through without developing any symptoms of COVID. Remember, they qualify for home-based isolation because majority of our people are still asymptomatic. 90% of the infections we get in our setup are asymptomatic. Therefore, that gives us a very good platform to be able to implement home-based care interventions. And also because home-based care is 9 times cheaper than institutional care. So we support the healthcare workers who are afflicted, but we also going to work very closely with Nairobi Metropolitan Services to ensure that the facility in the School of Nursing is immediately put to use. So I think that's all. Maybe I can open it up for a question and answer. Please tell us. Yeah, can you coordinate that on our behalf?
My name is Nasibo.
Pleasure, Nasibo.
I wanted to find out, this is not the only institution that has so far, the only public institution that has confirmed cases. First of all, can you confirm if Public Service Commission has also had a number of cases reported, I think 10, and what is going forward, what is the government doing in terms of, I know as far as PSC was concerned, you said you're going to scale down, but what other measures are you going to put in place moving forward?
Okay. Next.
My name is Denise from Maternity. I'd kindly like a breakdown the number of the 41 positive cases. How many are support staff, how many are nurses and administrators? Then again, how many people are in the isolation center and how many people from the positive cases are on home?
Speak up a bit.
As for the ones that have tested positive, how many are in the isolation center and how many are under home-based care?
Apart from healthcare workers who have tested positive, mothers and children, we have who have tested positive. And the other question, with the number of health workers tested positive, how many in the country have existing health conditions, and how are they being treated, or are they working, or are they out of their service?
Oh, maybe you can answer those ones, otherwise we lose track. Nasibo, Public Service Commission, yes. We have had cases of COVID-19 positive from Public Service Commission. We are working very closely with the Commission to ensure that we scale down operations, therefore maintaining maximum physical distancing and also allowing people to work from home. I may not be able to disclose the actual numbers, but yes, we have had cases from Public Service Commission, and we have also done disinfection of the premises, and of course we'll continue to highlight on the infection prevention control measures like everywhere else where you have reported a case, that the hand washing, the wearing of masks, the physical and social distancing will continue to be maintained. Regarding your question, the breakdown out of the 41, 19 are healthcare workers, frontline healthcare workers, and I think 21 or 22 are support staff, ancillary staff from revenue, kitchen, CSSD, and the like. And all these people are under home-based care isolation. None is under institutional isolation. because one, none of them have a coexisting condition. Number two, they are asymptomatic. And number three, they fit the home-based care guidelines that were put in place. Your other question, we can be able to give you the breakdown in terms of the healthcare workers. Total number of healthcare workers who have been exposed or who are infected with COVID-19 as at yesterday nationally stands at 429, which is 4.1% out of the total number of cases. And we'll continue to support the healthcare workers, those who are in home-based care isolation, and a few who are under institutional isolation, giving them moral and psychosocial support during this difficult period. And we hope and pray that all of them will be able to pull through and come back to support us in the fight against the pandemic. Dr. Kibaru?
How many health workers in total?
429, 4.1%.
I wanted to know the status of those health workers who have pre-existing health conditions. What is their status?
We'll be able to give you that information in our afternoon presser because we are working out the figures as we speak. Yeah.
Breakdown of the 429.
I can read for them.
Oh, the team, I think that there's one doctor.
Let me take it.
Yeah.
Yeah, in terms of the breakdown, we have two who are coming from the building works, 4 from CCC, 2 from CSSD, that is where we sterilize things, 1 from housekeeping, 1 from isolation, 2 from kitchen, 3 from labor ward, 3 from laundry, 1 from laboratory, 4 from MCH, 3 from newborn unit, 3 from NHIF office, 2 from pharmacy, 2 from security, 5 from theater,